Hello, and thank you for joining me. Today we are going to talk about a medical issue that is surprisingly common and can be incredibly painful: kidney stones. Think of your kidneys as your body's sophisticated filtration system. They are two bean-shaped organs, each about the size of your fist, located just below your rib cage. Their main job is to remove waste products, remove excess fluid, and produce urine. This process is vital for maintaining a stable balance of body chemicals. When everything is working correctly, this system runs smoothly in the background, but sometimes this delicate balance can be disrupted, leading to problems. So, what exactly is a kidney stone? A kidney stone is a hard, pebble-like object that forms inside your kidneys. These stones are created when high levels of certain minerals and salts in your urine crystallize and stick together. Imagine adding too much sugar to a glass of iced tea. Eventually, the sugar forms solid crystals at the bottom. A similar process happens inside your kidneys. These stones can be as tiny as a grain of sand, or in some rare cases as large as a golf ball. While the small ones might pass out of your body without you even knowing it, the larger ones can cause significant issues. The journey of a kidney stone is where the trouble often begins. A stone can stay in the kidney for weeks, months, or even years without causing any symptoms. The problem arises when it decides to move. If a stone travels from your kidney into the ureter, the narrow tube that carries urine to your bladder, it can act like a dam. This blockage can cause urine to back up into the kidney, leading to swelling and severe pain. It's this movement and blockage that are responsible for the intense symptoms many people associate with this condition. Understanding this process is the first step toward managing and preventing these unwelcome guests in your urinary system. Here at Happy Health 10, we believe that knowledge is the foundation of good health. By understanding what kidney stones are and how they form, you are better equipped to take proactive steps. This condition affects millions of people around the world each year, but it is not something you have to face without information. It's important to know that while they can be extremely painful, kidney stones rarely cause permanent damage if they are diagnosed and treated properly. Now that we understand what kidney stones are, let's explore why they form in the first place. There isn't a single cause for every kidney stone. Instead, several factors can increase your risk. The most significant and common cause is not drinking enough water. Dehydration is a major culprit. When you don't consume enough fluids, your urine becomes more concentrated. This means the waste products, minerals, and salts within it are less diluted. In this concentrated environment, substances like calcium oxalate uric acid are much more likely to crystallize and bind together, forming the hard masses we call kidney stones. It's a simple equation. Less water means more concentrated urine, which creates a perfect breeding ground for stones. Your diet also plays a crucial role in the formation of kidney stones. A diet high in protein, sodium, basically salt and sugar. For example, eating a lot of salty foods causes your kidneys to excrete more calcium into your urine, which can then combine with other substances to form calcium oxalate calcium phosphate. Similarly, high protein diets, especially from animal sources like red meat, can increase the levels of uric acid in your body. This can lead to the formation of uric acid stones. It is a clear reminder that what we eat has a direct impact on the inner workings of our organs, including our hardworking kidneys. In the following sections, we will explore why these stones form, how to recognize their symptoms, and what you can do to find relief and prevent them from coming back. One of the most defining characteristics of a kidney stone is the pain it can cause. However, a stone might not cause any symptoms at all while it is quietly sitting inside your kidney. The signs usually appear when the stone begins to move into the ureter. The most common symptom is a severe, sharp pain in your side and back just below your ribs. This pain is often described as one of the most intense pains, sometimes compared to childbirth or a broken bone. The pain may come in waves, fluctuating in intensity as the stone moves. This is known as renal colic. This classic back and side pain isn't the only symptom to watch for. As the stone continues its journey, the location of the pain can change. You might feel the pain radiating to your lower abdomen and groin area. For men, this pain can extend to the testicles. The discomfort is a direct result of the stone scraping against the delicate lining of the ureter and the pressure building up behind it. This movement and irritation can also cause other noticeable symptoms related to urination. It's your body's way of sending you clear signals that something is wrong and needs attention. When you are dealing with the discomfort of a small kidney stone, there are several things you can do at home to help manage the pain and encourage the stone to pass. The single most important home remedy is to drink a lot of water. Aim for at least 2 to 3 liters, about 8 to 12 glasses per day. Increasing fluids helps dilute your urine and flush the urinary system. This can make it easier for a small stone to pass on its own. While water is best, herbal tea diluted fruit juice can also help you reach your fluid goal. Keep your urine light yellow or clear. Certain natural remedies may provide additional relief. A popular home remedy: lemon juice, olive oil and water. Citric acid in lemon may help break down small calcium stones and prevent them from growing. Olive oil is thought to act as a lubricant to help passage. Scientific evidence for the full concoction is limited, but citrate is a known inhibitor of calcium stone formation, so add fresh lemon to your water throughout the day to boost citrate and stay hydrated. While home remedies can be effective for small, uncomplicated kidney stones, it is crucial to recognize when you need professional medical help. You should see a doctor immediately if your pain becomes unbearable and cannot be managed with over-the-counter medication. Severe debilitating pain is a sign the blockage may be significant. If you are experiencing this level of pain, persistent nausea, vomiting, that prevents you from keeping fluids down, you risk becoming dehydrated, which can worsen the situation. Your doctor can provide stronger pain medication and intravenous fluids to keep you hydrated and comfortable. Another critical reason to seek immediate medical care is the presence of a fever and chills. These symptoms could signal a serious infection in your kidney or urinary tract, which is a medical emergency. An infection combined with a blockage can lead to a life-threatening condition called urosepsis. Do not wait to see if these symptoms will go away on their own. Anytime you suspect an infection, it's time to let a medical professional take over. Prompt treatment with antibiotics is necessary to clear the infection and prevent it from spreading throughout your body. Your health and safety are the top priorities.